Bismillahirrahmanirrahim. Assalamu alaikum. Today the topic of our lecture is dental porcelain, also known as dental ceramic. Let's move on to the learning objectives. So the learning objectives of this topic are to understand what are dental ceramics or porcelain. As I mentioned, these two terms may be used and their composition. Classify ceramics according to the fusion temperature and the manufacturing techniques. This classification is very important according to the prof. Explain what are the common manufacturing methods of ceramics. And list the properties of dental ceramics along with associated clinical applications. Understand the CAD-CAM technology and explain the strengthening mechanisms of dental ceramics. So in all the previous lectures, we've discussed various tooth replacement methods, and we have used direct restoration, we have used indirect restoration. So basically dental porcelain or dental ceramics is used for indirect tooth or teeth replacement. So there are various options for several missing teeth, like the removable partial dentures, which are made of acrylic. Then we have tooth supported fixed bridges and implant supported fixed bridges. For the single tooth replacement, we have again removable partial denture, tooth supported fixed bridge, and implant supported crown. So these are the different options for the tooth or teeth replacement. And as I mentioned, dental ceramics may be used in case of basically the tooth may be made of teeth may be made of porcelain in case of a removable partial denture. The crown or the different abutments may be made of porcelain in case of a tooth supported fixed bridge, and in case of an implant supported fixed bridge, again the abutment may be made of porcelain. Now, what is ceramic? Ceramic is derived from the Greek word ceramos, meaning burnt material. Ceramic, if you look at the definition, so it is an inorganic compound with non-metallic properties, typically composed of metallic or semi-metallic and non-metallic elements, for example aluminum oxide, calcium oxide, and silicon and potassium compounds. Now, dental ceramics may be defined as an inorganic compound with non-metallic properties, typically composed of oxygen and one or more metallic or semi-metallic elements. The definition is more or less same, but in this case the elements may be aluminium, calcium, lithium, magnesium, potassium, silicon, or sodium, and it is formulated to produce the whole part of a ceramic-based dental prosthesis. There are three main divisions of ceramics. They may be predominantly glassy materials, they may be particle filled glasses known as glass ceramics, or they may be polycrystalline ceramics. Aesthetic dental ceramics, where we need aesthetics, especially in the interior areas, they are glassy, and the substructure dental ceramics, which basically in which our priority is the strength and durability, we use crystalline dental ceramics. So what is glass in case of dental ceramics? It is an inorganic non-metallic compound that lacks a crystalline structure. We studied previously that a crystalline structure is regular and ordered. Glass ceramics are ceramics consisting of glass matrix phase and at least one crystal phase produced by controlled crystallization of glass. And polycrystalline ceramics have no glassy components. The atoms are densely packed and regular network. And in this case, crack propagation is different. So these are the three different kinds of ceramics that may be present. Now, dental porcelain. The compositional range containing kaolin, silica, and feldspar is called porcelain. Ceramic composed of glass matrix phase and one or more crystalline phases such as lucite, which is basically a compound of potassium and aluminum, potassium aluminum oxide, silicon dioxide. And this is typical of dental porcelain. It's known as lucite. Now, if we are asked what is the difference between ceramic and dental ceramic or porcelain, the main and the major difference is the composition. And what is the compositional difference is that feldspar, silica, kaolin, potash, soda, and lime are added to give special properties. And that's basically what makes the dental ceramic different from the conventional ceramic. Conventional ceramic is used in various things like your crockery, your dishes, and a lot of other things are made of ceramics in our daily life. daily use. So ceramic is a fusible composition of silica and potash, whereas porcelain contains infusible elements held together by lower fusing materials and is less transparent. So apart from the compositional difference, there are differences in the properties as well. Now let's discuss the classification. Firstly, according to the chemical composition, they may be classified as silicate ceramics, glass ceramics, oxide ceramics, and non-oxide ceramics. The silicate ceramics consist of a crystal phase and glass phase, and mainly silicon dioxide glass phase with small addition of crystalline aluminum oxide, magnesium oxide, zirconium oxide, and or other oxides. So these are silicate ceramics. And an example is dental porcelain, which is typically silicate. Then the glass ceramics, which are partially crystallized glasses produced by controlled crystallization, which involves nucleation and growth of crystals in a glass matrix phase. And the example is DICOR glass ceramic. DICOR is the commercial name of a special kind of ceramic, which we will be discussing later on. Its manufacturing technique is very different. So that is an example of glass ceramic. Now, dental ceramics may be defined as an inorganic compound with non-metallic properties, typically composed of oxygen and one or more metallic or semi-metallic elements. The definition is more or less same, but now moving on to the classification based on types, there are various kinds of porcelains like feldspathic porcelain, aluminous porcelain, lucite reinforced porcelain, pure alumina, pure zirconia, glass infiltrated alumina or zirconium, glass ceramic, and lithia based glass ceramics. So this is basically based on the type of porcelain and basically its main constituent, which may be feldspar, aluminum, lucite, according to the type. The recent types of ceramics are the castable glass ceramics, and the commercial names are Ceram Alumina, Ceram Spinell, pressable ceramics, for example, Empress. These are all the manufacturing names or the commercial names. CAD-CAM ceramics, for example, Cerec and Vitablock, and then the injection molded ceramics, for example, optically. Now let's look at this table, which basically consists of the different types of ceramics and their strength and the indications or the uses. Lucite, also known as IPS Empress, has a flexural strength of about 160 megapascals, and because the strength isn't very high, it is used mostly in veneers, inlays, onlays, 3/4 crowns, and single unit bridges. If we move on to zirconia, which is one of the latest ceramics, and you can see by the strength it is about 900 to 1200 megapascals. This is used in single unit interior crowns, single unit posterior crowns, interior and posterior bridges, and implant abutments, as well as posterior crowns and bridges. So basically, because of the high strength, they are used in basically both posterior and interior crowns and bridges, and also implant abutments. And if you look at the ones in the intermediate ceramics, lithium and alumina, their flexural strength is also it's not very high. So that is why they're usually used for inlay, onlays, or single unit crowns and interior bridges, where the strength is not the main priority. Now, the very important classification, which is also asked in your exam, is the classification according to the fusion temperature. So there are three different fusion temperatures upon which porcelain may be fused or baked. Fusing is basically similar to baking, because the porcelain or the dental ceramic is baked at high temperature in a specialized furnace. So the high fusing dental porcelain are fused at 1300 degrees, the medium fusing from 1100 to 1300 degrees C, and the low fusing from 850 to 1100 C. So this classification, as I mentioned, is very important, and you are mostly asked to write or explain this classification. Now, an example of high fusing is feldspar based porcelain, which is 75 to 85% feldspar, 12 to 22% silica, 4% kaolin, and this is used for production of denture teeth, because we need high strength, insolubility, and translucency. Moving on to the medium fusing, is used for the production of denture teeth and all ceramic crowns, and high strength, insolubility, and translucency again are the features of this porcelain. Now the low fusing porcelain, which fuse or which are basically manufactured at 850 to 1100 degrees Celsius, They contain 60% feldspar, 25% silica, and no kaolin. The important feature is that kaolin is absent in this ceramic, and this is only used for crown and bridge construction. It is not used for denture teeth. Now, if we classify according to the microstructure, again, they may be classified as glasses, crystalline, or the crystal containing glass. According to translucency, there are three types of ceramics: opaque, translucent, and transparent. If we classify them according to the application, they may be classified as according to those used in fixed partial dentures, in metal crowns, in all ceramic crowns, inlays, onlays, and veneers, and in ceramic denture teeth. As we studied previously in artificial teeth, that there are two kinds of denture teeth: acrylic and porcelain teeth. So basically, they're also used for the manufacturing of artificial teeth. So you can see from this picture that the first picture shows an all ceramic crown, which is purely ceramic, then a porcelain fused to gold crown. So in this case, the substructure or the inner structure is of a metal. In this case, it's gold, and porcelain is fused on top of it. And in the third type, it's porcelain fused to metal. The metal may be nickel chromium or cobalt chromium, and on top of that, porcelain is fused. This is also known as a porcelain fused to metal crown, a PFM, and we will also be discussing in detail how that is formed. Now let's move on to the fabrication techniques of all ceramics, which means purely ceramic process. There are various methods. All of these methods are important. You should have a good knowledge, especially the ones that I've ticked. Sintering, partial sintering, casting and ceramic are important. Slip casting, CAD-CAM. These three techniques are important and have been previously asked in your prof SEQs. Then heat pressing and copy milling. We'll look at all of these individually. So the sintering or firing technique basically is the simplest technique of fabrication of porcelain. Process responsible for fusion or densification of porcelain particles to form a continuous mass. As I mentioned, we do the firing or the manufacturing of porcelain in a furnace. So a preheated furnace at approximately 650 degrees Celsius. And what happens is that the densification of the porcelain particles takes place and it forms a continuous mass. And initially, porcelain particles bond at their contact points and the crystalline growth takes place and they form a continuous mass of the desired shape and size according to your prosthesis. Now, the finer the particle size and lower the viscosity, more is the densification. Minimum 3 firing operations. So the furnace has three different operations. First, we get the opaque layer initially, then the dentine and enamel layer, and then the stain and glazing. So these are basically firing cycles which we carry out, and the temperature and the time varies, and according to that we get our three layers. Now the very important stages during firing of porcelain. This has also been asked previously in your UQs. There are three stages. The low vis stage, this is the initial stage where the material develops rigidity. The fluxes within the porcelain powder start to flow. Then the medium vis stage where the shrinkage occurs. Now this is basically the stage where the maximum shrinkage occurs. Cohesion between particles takes place. Densification starts and solidification starts, and then the high vis stage, no further shrinkage occurs, and this can be said as the final stage where the whole mass solidifies and forms a certain shape. Sintering is usually carried out under vacuum, and the advantage is that it reduces porosity, air pressure is decreased, and as temperature reaches firing point, vacuum is released and pressure returns to the room, basically the atmospheric pressure. Advantages of vacuum firing: improved translucency, decreased porosity, increased impact strength, decreased surface roughness. So basically the smoothness of the prosthesis is enhanced, and reduced porosities from 5 to 2.5%. Now let's move on to the next fabrication technique, which is casting and cerraming, and the commercial name is DICOR. This is very important and you should have a good knowledge of this technique. So basically in this case, the glass is available as ingots. Ingots are basically blocks. So the porcelain is porcelain. In this case, we don't use porcelain powder. We have glass ingots. The ingots are placed in a specialized zirconia crucible and heated at 2600 degrees Fahrenheit. So this process is similar to the casting technique we did of metals, but in this case, the crucible is made of zirconia and the temperature that we require is very high. in glass blocks or ingots are used. Casting is recovered in the same way. The glass ingots melt at high temperature, and the molten glass flows into the wax pattern, and we get the desired restoration. The casting is recovered by sandblasting, and the screw is cut, and the restoration is finished. So it's more or less similar to the casting of metals. Casting is embedded in a gypsum bonded investment and subjected to controlled crystallization. Cycle runs from 650 to 1075 degrees for 1.5 hours and then is sustained for 6 hours. Now the very important point here is that tetrasilicic fluoroalumina crystals are formed. Now these crystals basically act as interlocking glass crystals in the glass matrix, and that's why they are known as castable or cerammed dental ceramics, and the classic example is the DICOR ceramic. Let's move on to the heat pressing technique. In this, the ceramic cools and takes form of a mold. Investment is broken and ceramic prosthesis is debrided, is then stained and glazed or veneered with thermally compatible ceramic. Then copy milling. In this, firstly we make a hard resin pattern on a stone die. The pattern is copied and machined from a ceramic block using a pantographic device. So basically there is a software and a machine that copies the ceramic block, the pattern that we make on the ceramic block, the copy that we basically make on the stone die. It traces it, it scans it, and then it basically copies it onto the ceramic block. But it has the limitations that it has high cost and poor marginal accuracy. Now then comes the CAD-CAM. This is one of the latest techniques. CAD-CAM stands for Computer Aided Design and Computer Aided Manufacturing. This is one of the upcoming techniques, and it produces very accurate and fast restorations. So it's very time saving, and it is used for restorations like crowns, inlays, onlays, veneers. And the best part is that they are produced in one office visit. So what happens that after tooth preparation, the tooth is optically scanned. This is also known as a digital or optical impression, and computerized image is obtained on the computer screen. Again, it has a specialized software, and this is the machine, the CAD-CAM machine. The restoration is designed with the aid of a computer. The software that is inside it basically scans the prepared tooth. The ceramic block which is present inside the machine is machined by diamond coated disc whose movements are guided by the computer controlled input. So the same pattern or the same, all the dimensions, the shape, the size are basically copied onto the ceramic block. Now the advantages of CAD-CAM: negligible porosity because the steps are reduced, with no need of putting the ceramic into a furnace, no need for making an impression, a single appointment, and good patient acceptance because there are no, basically just one step is required, which is the scanning of the tooth, the prepared tooth of the patient, and the restoration of prosthesis is basically delivered the right next day or even on the same day. Disadvantages, however, that it is very expensive and technique sensitive, lack of computer control processing to support occlusal adjustment. Now the occlusal adjustments are basically the relation with the opposing teeth or the placement in the dental arch. That is difficult to basically replicate with this software, and then poor marginal accuracy. This is also one of the major drawbacks. Now another manufacturing technique is called slip casting, and the commercial name for this kind of porcelain is Ceram and Ceram Spinell. So we won't go into the detail of these procedures because they're very complicated. At your level, you should just have an idea of what basically these procedures are about. So in this, a slurry of ceramic material is condensed and placed onto a porous refractory die. So first we make a die of the single tooth, and the slurry of the ceramic material is condensed onto that die. Then it is heated in a furnace to produce a partially sintered coping. So a partially sintered coping is basically like an outer layer or a substructure of your prosthesis, and then the coping is basically further built upon, and it is infiltrated with a slurry of glass powder at a higher temperature of 1100 for 4 hours to eliminate porosity, reduce viscosity, and strengthen the slip cast score. And this kind of ceramic shows high toughness and reduced porosities. So in slip casting, basically we are just condensing the slurry of ceramic onto a die and heating it at a specific temperature, and the enhanced properties of better toughness and reduced porosities are shown. So this is called slip casting. Now let's move on to the composition of porcelain. So dental porcelain contains mainly feldspar, which is about 60 to 80%, and this is the basic glass former. Then quartz, which is 15 to 25%, and the function is that it acts as a filler. Then we have fluxes like oxide and alumina. Then metallic pigments, which give the color or the aesthetics that makes it look like natural tooth. And then kaolin is present as a binder in 3 to 5%. So this is the composition of dental. Now let's look at the individual constituents. Kaolin, or the white china clay, is basically hydrated aluminosilicate, and this acts as a binder. Basically it holds together the porcelain mixture. It produces plastic mix when mixed with water. And dental porcelain contains little or no kaolin. As you saw from the composition, it's only 3 to 5%. It's primarily used for making metal ceramics of porcelain fused to metal crowns. Feldspathic porcelain is the commonly used porcelain in dentistry. Melts at 1150 degrees and forms two phases, a crystalline and a glass phase. The crystalline mineral phase is called lucite or potassium aluminosilicate. So these are the different names at the different phases during the porcelain firing mechanism. And lucite, an important point is that lucite has the highest coefficient of thermal expansion, about 200 to 20 to 25 parts per million per centigrade, and the ability of feldspar to melt between 1150 and 1530 gives it ability to form crystalline lucite. This aids in the manufacture of porcelain for metal bonding. When we will be studying the porcelain and metallic bonding in detail, we'll see that because of the ability of feldspar to melt between the certain temperature range, this basically mechanism allows the bonding of metal to porcelain. Now, what is the function of fluxes? So these are low fusing classes that are added to reduce the temperature, and this is required to sinter the porcelain particles at low temperature so that alloys, in case of porcelain and metal, the alloys do not melt. If we go at high temperatures, the alloys can melt. That's why we add fluxes to lower the sintering temperature. Then the glass modifiers, they increase the fluidity, also lower the softening temperature and increase the thermal expansion, so the porcelain particles are able to flow and fuse together. Disadvantages, however, that it is very expensive and technique sensitive, lack of computer control processing to support occlusal adjustment. Now the occlusal adjustments are basically the relation with the opposing teeth or the placement in the dental arch. That is difficult to basically replicate with this software. And then poor marginal accuracy. This is also one of the major drawbacks. Then glazes. Glazes are basically added to reduce the crack production in the outer layer, to remove the surface imperfections and seal any kinds of pores, and improve the overall appearance and aesthetics. So now there are two types of glazes, self-glaze or autoglaze, and the add-on or overglaze. Now the self-glaze or autoglaze, as the name suggests, they are already present within the porcelain. We don't have to add them on later. And how do they work? The porcelain is subjected to fusion temperature. The surface particles flow to form a vitreous layer and better properties are achieved. So the glazing cycle is present within the porcelain. It takes place at the end. At a certain temperature, when the porcelain is subjected to it, the glaze forms over the porcelain and it gives a lustrous and shiny surface. Now add on or overglaze, this the mechanism is different. The dental glaze is separately mixed with water and applied onto the surface and placed back into the furnace, and then the glaze cycle is applied, a certain temperature is given, and this leads to the formation of a glazed surface. uh, it's an unnatural shiny appearance, and it just leads to loss of contour. So that is why a self glaze or auto glaze is always preferred compared to the add-on or overglaze. Now, dental ceramics may be defined as an inorganic. Now, let's move on to the next fabrication technique, which is casting and cerraming, and the commercial name is DICOR. This is very important, and you should have a good knowledge of this technique. The thermal properties, it has a low thermal conductivity. It's an insulator basically. Coefficient of thermal expansion is closer to tooth. Physical properties are very good, and mechanical properties obviously are also very good. Let's look at them individually. As I mentioned, low thermal conductivity, coefficient of thermal expansion near that of enamel and dentine. Physical properties, it is brittle. This is one of the disadvantages of dental ceramics, that it is very brittle. Low fracture toughness, linear firing and volumetric shrinkage is present. Density varies with the porosity. Looking at the mechanical properties, high compressive strength but low tensile strength. So that is why it is brittle. Chemical properties, it is extremely resistant to most of the solvents. It is stable within the oral cavity, does not degrade over time. Only hydrofluoric acid can dissolve the ceramic material. Otherwise, it is highly resistant to the solvents. Let's move on to the manipulation of porcelain. So porcelain is firstly condensed. We have the porcelain powder which we mix with water, and it is present in different shades, and that is selected first for the body or the dentine portion, and then it is condensed into the desired onto the desired prepared onto the die into the desired shape and anatomy. And three methods may be used for condensation: mild vibration, clean excess water by tissue paper, and use a brush to dry to basically add the dry powder to absorb the excessive water. So these are all clinical or technical steps which we won't go into detail. At this stage, you should just know that the porcelain is mixed with water and a slurry is formed, and that is condensed onto the die, as you can see from the picture. The recent types of ceramics are the castable glass ceramics, and the commercial names are Ceram Illumina, Ceram Spinell. Pressable ceramics, for example, Empress. These are all the manufacturing names or the commercial names. CAD-CAM ceramics, for example, Cerec and Vitablock. And then the injection molded ceramics, for example, optically. This is a metal ceramic restoration. As you can see that the metallic substructure is present underneath, and the porcelain is present on the outer surface, and there are different basically shades: the body dentine porcelain, incisal porcelain, opaque porcelain. So basically when we are condensing the porcelain, we apply these shades separately, and when we place them in the furnace, the different firing temperature gives these different types of porcelain. So these restorations are composed of a metal substructure supporting a ceramic veneer, which are chemically and mechanically bonded together. So over here there is a mechanical and chemical bond taking. What are the different metal alloys for porcelain? Well, we can use gold alloys. They have excellent bond and biocompatibility, but they are less stiff. Then we have low gold alloys and silver palladium. And then the most commonly the base metal alloys like nickel chromium and cobalt chromium. Now they're stiff and sag resistant, but poor bonding has been noted that it has poor bonding to porcelain compared to gold. And they're difficult to cast. It has high casting shrinkage, and the nickel allergy is a possibility. But the main factor that overrules all the other disadvantages is that it is cheap. So that is why it is commonly used with porcelain. So now how does the bonding of porcelain takes place to the metal coping? Firstly, the first mechanism is mechanical bonding. As you can see from this picture that the upper blue layer is porcelain, and then the silver layer is metal. Now the bond between both of them takes place via the oxide layer and irregularities. So the mechanical bonding basically takes place by irregularities, the infiltration of the fused ceramic into the surface irregularities. What we do is we carry out sandblasting, or we make the surface irregularities on the metal. So at high temperature, the molten porcelain fuses into these surface irregularities and roughnesses, and they get interlocked. So this is how mechanical bonding takes place, by the flow of the ceramic into the irregularities of the metal. The chemical bonding takes place by the metal oxide layer, which is due to the indium and tin present in the porcelain, and this takes place between and this basically happens because of the metal oxide layer and the opaque porcelain. So the first step for oxide formation is degassing. We studied degassing previously. The purpose of degassing is removing the surface contaminants and grease, because we want a smooth and clean surface for any kind of layer formation or any kind of bonding. And then a thin oxide layer provides stronger bond than a thick one. And it is observed that the oxide layer in noble alloys, especially gold, is better and stronger than that in the base metal alloys. So this is how chemical bonding is achieved. It is basically ionic bonding. Then the coefficient of thermal expansion mismatch. These are three mechanisms basically by which porcelain bonds to metal. One was the mechanical bonding, then the chemical bonding, and then the third is the coefficient of expansion mismatch. So what is this basically? As mentioned in the previous slides, that the metal alloy has a higher coefficient of thermal expansion than the porcelain, and what happens that is basically because of the coefficient of thermal expansion mismatch, the fused porcelain gets sucked or attracted to the metal surface because of the difference, and this causes residual compressive stresses. Because it is sucked or attracted towards the metal surface, compressive stresses are generated, and these compressive stresses as a result strengthen the porcelain and provides a better bonding between them. So these are the three mechanisms of bonding of porcelain to. Now let's move on to the certain methods that we can use to strengthen or toughen the ceramics. This is a very important UQ question as well, and it has been asked many times in your exam. So as we mentioned that ceramics are weak or brittle, they have high compressive strength but low tensile strength. And the reason is that they are bonded by covalent bonds, which as you know are weak bonds. And then they have inherent flaws within themselves. They have cracks, micro or nano cracks within their structure. And there is a potential for more fracture in the moist environment, because they go into the oral cavity, and the oral cavity, as you know, is moist. The presence of saliva, that gives rise to more fracture. So that is the reason why ceramics are basically weak. Now this flowchart very clearly depicts the different methods of strengthening ceramics. So there are two ways. Basically, the first is the design. We can manipulate the design so that it ultimately leads to increased strength and toughness of ceramics, and we can do that by minimizing stress concentration and minimizing the tensile stress. Now, by the methods of strengthening the brittle material, again two ways: by development of residual compressive stresses within the surface of the material, which ultimately leads to its increased strength, and this can be done by chemical binding or ion exchange method, thermal tempering, and thermal compatibility. And then the interruption of crack propagation through the material. This can be done by dispersion of the crystalline phase or by a method called transformation toughening. So the toughening mechanisms, if we look at them, there are two types: intrinsic or the crystal reinforcement, and extrinsic or the chemical strengthening or glazing. Now the intrinsic or crystalline reinforcement, what we do is that we use the dispersed crystalline phase, which acts as a crack reflector if the coefficient of expansion is higher than the glass phase. So basically what it's doing is it's preventing crack growth within the structure, and this as a result leads to the toughening or strengthening of the ceramic. Then the extrinsic, in which the chemical strengthening and glazing fall under. So the chemical strengthening is also known as ion exchange, and this leads to creation of a compressive layer on the top of the ceramic. The ceramic is placed in a molten salt bath, and the salt bath basically contains potassium solution. And what happens is that the small alkali ions like sodium within the glass matrix of the ceramic are exchanged for the larger ions like potassium present in the salt bath, and this is performed between 450 to 480 degrees Celsius. What happens is that when the potassium ions move into the place of the sodium ion, they occupy greater space within the crystal, and this creates a compressive stress on the surface layer. And as we mentioned earlier, the residual compressive stress that is formed leads to its strengthening. Then glazing. As I mentioned in the earlier slides, glazing is shown to ultimately strengthen the ceramic as it reduces the depth and width of the surface flaws. Low expansion glass is applied on the surface and fired at a higher temperature. So this is basically an add-on glaze. And what this does is that it also creates residual compressive stresses as it's placed under compression upon cooling due to contraction of the underlying ceramic. So the underlying ceramic undergoes cooling, and what happens that the top layer undergoes compression, and as a result this leads to a stronger and tougher ceramic restoration. Let's look at the types of strengthening, or basically the mechanism of strengthening. The residual compressive stresses can be generated by ion exchange, which we mentioned, the salt bath, thermal tempering, thermal compatibility. We'll discuss both of these in detail. As you can see from the picture below, the process of ion exchange, the large potassium ions are moving into place of the sodium ions, and this is generating a residual compressive stress. The interruption of crack propagation. So we are actually manipulating the intrinsic or the crystalline structure. So addition of a dispersion phase. When we add a dispersion phase, this leads to the toughness of particle. This can be done by adding aluminium or DICOR, and change in the crystalline structure, for example, partially stabilize the core. So these are the different dispersion phases that we can add into the ceramic to cause its toughness by interruption of the crack growth. Now thermal tempering, as mentioned in the previous slide, this is a type of toughening mechanism. So what we do is that we basically carry out rapid cooling or quenching of the ceramic while it is hot and in the softened molten state. What does this do is that it creates residual compressive stresses. The rapid cooling produces a skin of rigid glass surrounding a soft inner molten core, resulting in residual compressive stresses on outer surface, providing a protective layer. So the inner layer, which is basically molten, when it undergoes cooling, sudden cooling or quenching, the outer layer becomes rigid and gets sucked in and forms a residual compressive stresses, and this surface as a result provides a protective layer or a stronger layer, and this is known as thermal tempering. Thermal compatibility, mismatch of coefficient of thermal expansion. As mentioned earlier, that mismatch in the coefficient of thermal expansion also plays a very important role in the bond between the metal and porcelain in porcelain fused to metal. The same way, this also, as a result, increases its toughness and strength. So the metal and the porcelain used for the restoration are designed with a slight mismatch in the coefficient of thermal expansion. It should be different. So that what happens that when the coefficient of thermal expansion is different, and that is that for metal it is more than porcelain, the metal contracts more than the porcelain, and as a result, what happens that because the metal is because the metal lies below the porcelain, it's the substructure, it contracts more, and as a result, it creates again the same residual compressive stresses and provides additional strength. Now, let's look at this table, which basically consists of the different types of ceramics and their strength and the indications or the uses. Lucite, also known as IPS Empress, has a flexural strength of about 160 megapascals, and because the strength isn't very high, it is used mostly in veneers, inlays, onlays, 3/4 crowns, and single unit bridges. If we move on to zirconia, which is one of the latest ceramics, and you can see by the strength it is about 900 to 1200 megapascals. This is used in single unit interior crowns, single unit posterior crowns, interior and posterior bridges, and implant abutments, as well as posterior crowns and bridges. So basically, because of the high strength, they are used in basically both posterior. Then interruption of crack propagation can also be done by using DICOR castable glass ceramics. We studied this in the previous slides, that what happens is that basically DICOR or castable glass ceramics, they work the same way like they work the same way like the metals which are which undergo casting. We have the special investment materials, and the molten ceramic is flowed into the wax pattern, and the same way we achieve ceramic prosthesis or restoration. And DICOR, basically this is the commercial name of a castable glass ceramic, and it utilizes inhibition of crack propagation by the growth of mica crystals. So DICOR ceramics, basically when they are casted at high temperature, they form mica crystals, and these mica crystals act as filler or reinforcing particles, and they prevent the crack propagation. And as a result, when the crack propagation is inhibited, this strengthens the restoration. So these are the two methods of interruption of crack propagation. The first is by addition of alumina. The second is by using DICOR castable glass ceramic. Now, one of the recent advances in the interruption of crack propagation is the transformation toughening. Now, transformation toughening is basically a method which is used in zirconia, specifically zirconia ceramics, those ceramics that have zirconia. So basically this involves the incorporation of a crystalline material that is capable of undergoing a change in the crystal structure, because it's a transformation when placed under stress. So basically what happens is that in our zirconia ceramics, transformation toughening leads to transformation of zirconium oxide from a tetragonal phase to a monoclinical phase. So these are the two different phases or types of zirconia that exist, and so when we place this ceramic under stress, there is a change in the phase of the zirconia. It changes from tetragonal to monoclinic at the tips of the crack that are in the region of tensile stress. So you can see from the picture that this triangular thing is the crack, and what happens that when this zirconia ceramic is placed under stress, it undergoes a change from tetragonal to monoclinical, and when it undergoes this change, basically this results in the formation of residual compressive stresses, and that again leads to increase in the strength, and the crack propagation is stopped. So this is basically the change. This diagram is showing the change from tetragonal to the monoclinical crystalline structure. Now let's move on to the certain methods that we can use to strengthen or toughen the ceramics. This is a very important UQ question as well. and it has been asked many times in your exam. Now let's just look at the general properties of ceramics. It has excellent flexural strength. Glazed shows 141 megapascal strength and unglazed 75. So that is why glazing is very important. It ultimately improves the properties of the ceramic. The compressive strength is 331 megapascal. Tensile strength is low. That is why it is known as a brittle material. Shear strength is also satisfactory. Modulus of elasticity is good. It's 69 gigapascals. The hardness is very good. It's 460 loop hardness. It is chemically inert, less reactivity, so it is stable in the oral cavity. Brittle fracture, low fracture toughness because it's brittle. It has excellent biocompatibility. It has excellent color stability. It does not discolor or stain over time. Refractory nature, it is able to withstand high temperatures, high hardness, low thermal conductivity. It's an excellent insulator. Diffusibility, electric conductivity, these all are low, and it has a coefficient of thermal expansion closer to that of enamel and dentin. Advantages of porcelain: high abrasion resistance, chemical inertness, excellent thermal and electrical insulator, excellent aesthetic qualities, translucency, color stability, it can simulate the natural tooth, capacity of pigmentation. Again, you can replicate the surrounding teeth if they are pigmented, if they are stained. You can achieve the same result with your porcelain restorations. Stain resistant, enhanced polishability, and very, very durable. Let's look at the types of strengthening, or basically the mechanism of strengthening. The residual compressive stresses can be generated by ion exchange, which we mentioned, the salt bath, thermal tempering, thermal compatibility. We'll discuss both of these in detail. As you can see from the picture below, the process of ion exchange, the large potassium ions are moving into place of the sodium ions, and this is generating a residual compressive stress. The interruption of crack propagation. So we are actually manipulating the intrinsic or the crystalline structure. So addition of a dispersion phase. So that brings us to the end of today's topic, which is dental ceramics. I hope everything is clear and you know what you are required to basically study for your exam. And this also brings us to the end of our course. We are done with our dental materials course. So if you have any questions, please feel free to ask me. Thank you so much for your time and all the best for your exams.